Back when I was 68, I used to take 3 different medications every day just to keep my high blood pressure under control. But even then, some mornings I'd wake up dizzy. Other days, I'd feel like my heart would jump out of my chest. One time, I passed out in my garage, thought it was dehydration. My doctor said it was stress. Said it was age. Said it was just normal. But let me tell you something I wish someone had told me years ago. If your blood pressure keeps acting strange, even on meds, there's a chance. You don't have the kind of hypertension they think you do. You might have something called secondary hypertension, a hidden condition that affects about 1 in 5 people with high blood pressure. And unlike the common kind, called primary hypertension, this one usually has a real cause, like your kidneys, your hormones, or even the pills you're taking every day. It took me years and a second opinion to discover what was happening in my body. I'm sharing this because if someone like me, a man who always did what the doctor told him, almost missed this, then maybe you might be missing it too. In this video, I'll explain what to look for, what to ask your doctor, and why resistant hypertension doesn't always mean you need more drugs. Sometimes, you need better questions. Do me a favor, comment below if you or someone you love has been fighting blood pressure that just won't stay down. And stick around to the end, I'll show you a simple checklist you can take to your next checkup, to find out if your high blood pressure might actually be something deeper, and fixable. I still remember that cold morning. I was walking to the mailbox, coffee in hand, when my vision suddenly went blurry. My knees buckled. I held onto the fence for dear life. My neighbor saw me and rushed over. I told him, I think I need to sit down. Later that day, at the clinic, my blood pressure read 186/104. The nurse widened her eyes. The doctor looked at my chart and said, "Well, Harold, looks like your high blood pressure is acting up again. Let's up your dose." No test. No questions. Just another pill. That night, I sat alone in my living room, staring at that little orange bottle. And I asked myself, what if this isn't just aging? What if there's more to it? And that, my friends, was the moment everything changed. You see, there are 2 kinds of hypertension. Most people only hear about one. The common one is primary hypertension. It's like the mystery drawer in the kitchen, messy, unclear, just there. Doctors don't know why it happens, so they manage it with lifelong meds. But then there's secondary hypertension, and this one has a reason. A trigger. Something in your body that's not working right, kidney dysfunction, hormonal imbalance, even a small tumor you didn't know you had. Up to 1 in 5 people with high blood pressure have this. That's 20%. And yet, most never find out. Why? Because many doctors are trained to treat the average case. They assume, they generalize. They look at a 70-year-old man like me and think, yep, old age. Give him another pill. But if your blood pressure jumps up and down without warning, if it stays high despite multiple medications, if you have other weird symptoms like fatigue, chest fluttering, cold hands, or even frequent headaches, that's not just age. That's a red flag. I know this because I lived it. After I started reading and asking questions, I demanded my doctor check my kidneys, my adrenal glands, even my thyroid. Turns out, I had an adrenal overproduction condition called primary aldosteronism. My body was pumping out a hormone that made my blood pressure spike. The solution? A very specific medication. Within 3 months, I dropped one blood pressure drug entirely. Within 6 months, I was walking every morning again, steady, clear-headed, alive. Now let me ask you, has your doctor ever run a hormone panel or ordered kidney function tests beyond the basics? Comment below, I'd love to know. This isn't just about me. It's about your story, too. Because maybe, just maybe, you're not sick because you're old. Maybe you're sick because something is being missed. Stay with me, because in the next segment, I'll take you inside the 6 most common causes of secondary hypertension. We'll talk about what to ask, what to test, and how to advocate for your health. You don't have to be a doctor, just someone who refuses to accept "just take another pill" as the final answer. For years, I thought my high blood pressure was just part of getting older. But one quiet afternoon, something didn't sit right. Despite 3 pills a day, clean eating, and my daily walk, my numbers were stubborn. That's when I asked, could there be something else? And oh boy, was there ever. Let's explore the 6 silent culprits of secondary hypertension that might be hiding behind your symptoms. 1. Obstructive sleep apnea, OSA. Imagine your breathing stopping multiple times during the night without you even realizing it. That's OSA. It's not just about snoring, it's about interrupted sleep leading to increased blood pressure. Studies show that up to 50% of people with OSA have hypertension. 2. Primary aldosteronism, CON syndrome. This condition involves your adrenal glands producing too much aldosterone, a hormone that increases sodium retention and, consequently, blood pressure. It's more common than previously thought, affecting up to 10% of hypertensive patients. 3. Renal artery stenosis. When the arteries supplying your kidneys narrow, it reduces blood flow, prompting your body to raise blood pressure to compensate. This condition is especially prevalent in older adults and can lead to resistant hypertension. 4. Kidney parenchymal disease. Chronic kidney disease can impair the kidney's ability to regulate blood pressure, leading to hypertension. It's a common cause, especially in children and young adults. 5. Thyroid disorders. Both hyperthyroidism and hypothyroidism can influence blood pressure. An overactive thyroid increases heart rate and blood pressure, while an underactive one can cause blood vessels to stiffen, also raising blood pressure. 6. Certain medications and substances. Some drugs, including NSAIDs, antidepressants, and even herbal supplements like licorice, can elevate blood pressure. Always review your medications with your doctor if your blood pressure is uncontrolled. Recognizing these causes is crucial. If your blood pressure remains high despite treatment, it's time to dig deeper. In our next segment, we'll discuss how to approach your doctor about these potential underlying issues. I didn't question my blood pressure, until one unexpected result changed everything. Turns out, age and stress weren't the full story. Hidden causes were at play, ones that most of us are never warned about. The real challenge isn't just managing the numbers, it's knowing how to talk to your doctor and uncover what's truly going on. 1. Prepare your questions. Before your appointment, write down any symptoms you've been experiencing, even if they seem unrelated. This includes fatigue, headaches, or changes in your sleep patterns. 2. Discuss your medications. Bring a list of all medications and supplements you're taking. Some drugs, including NSAIDs, antidepressants, and even herbal supplements like licorice, can elevate blood pressure. 3. Request specific tests. Ask your doctor about tests to identify secondary hypertension causes. These may include blood tests to check kidney function, hormone levels, and imaging tests like an ultrasound or CT scan. 4. Monitor your blood pressure at home. Keeping a log of your blood pressure readings at different times of the day can provide valuable information to your doctor. Recognizing these steps is crucial. If your blood pressure remains high despite treatment, it's time to dig deeper. In our next segment, we'll discuss treatment options for secondary hypertension. I thought I had my blood pressure under control, with medication, a low-salt diet, and regular morning walks. But then one day, as the numbers on the monitor kept fluctuating, I was forced to face the most uncomfortable question of all: what am I missing? That's when I realized, true control doesn't come from suppressing the symptoms, but from finding the root cause. And the truth is, not all high blood pressure is the same. There are cases, called secondary hypertension, where the cause lies deeper, from an underlying condition. If you don't find and treat the root cause, no matter how much medication you take, the numbers will just keep going up. Let's explore the treatments for secondary hypertension. 1. treating the underlying cause. If a specific condition is causing your high blood pressure, addressing it directly can often normalize your readings. For instance, treating obstructive sleep apnea with CPAP therapy can significantly reduce blood pressure. 2. Medications. Depending on the cause, specific medications may be prescribed. For example, aldosterone antagonists like spironolactone are effective for conditions like primary aldosteronism. 3. Lifestyle modifications. Regardless of the cause, lifestyle changes play a vital role. Reducing sodium intake, engaging in regular physical activity, and managing stress can all contribute to lowering blood pressure. 4. Surgical interventions. In some cases, surgery may be necessary. For example, renal artery stenosis might require procedures to restore proper blood flow to the kidneys. Remember, it's essential to work closely with your healthcare provider to determine the best treatment plan for your specific situation. But wait, what if I told you that some of the medications you trust most might be silently working against you? In the next part, I'll reveal the common drugs that could be sabotaging your health without you even knowing it. You know, I always thought that medications were meant to help us. But what if I told you that some of them might be silently pushing your blood pressure higher? 1. Non-steroidal anti-inflammatory drugs, NSAIDs. Common pain relievers like ibuprofen and naproxen can cause the body to retain sodium and water, leading to increased blood pressure. 2. Decongestants. Over-the-counter cold remedies containing pseudoephedrine or phenylephrine can constrict blood vessels, raising blood pressure. 3. Hormonal medications. Birth control pills and hormone replacement therapies can elevate blood pressure, especially in women over 35 who smoke. 4. Antidepressants. Certain antidepressants, such as venlafaxine and bupropion, have been linked to increased blood pressure levels. 5. Stimulants. Medications for ADHD, like amphetamines and methylphenidate, can raise both heart rate and blood pressure. But here's the kicker, even some herbal supplements, like licorice root and ginseng, can contribute to elevated blood pressure. Surprised? In our next segment, we'll delve into these hidden culprits. If this information resonates with you, please like the video and share your experiences in the comments. Your story might help someone else. Let me ask you something, my friend. Have you ever picked up a bottle of herbal tea or a so-called natural supplement and thought, well, this must be good for me? I used to think that way, too. But as I got older, and wiser, after a few hospital visits, I learned a hard truth: not everything labeled natural is safe. Especially not when you've got high blood pressure or are at risk of a stroke or heart attack. Today, I want to walk you through some herbal remedies and so-called superfoods that might be sabotaging your health without you realizing it. 1. Licorice root. Now this one surprised me. Licorice sounds innocent, right? But if it contains glycyrrhizin, it can trick your body into retaining sodium and flushing out potassium. That combo? It raises your blood pressure. And the worst part? You'll find it in teas, candies, and even cough syrups. I had a friend, Martha, a lovely woman. She drank licorice tea every night. Ended up in the ER with severe hypertension. 2. Ginseng. My grandson gave me some ginseng capsules last Christmas. He said it'd help my memory. I thanked him, of course, but later I found out, it stimulates the nervous system, which can spike your blood pressure, especially if you already have insulin resistance or are taking other meds. It's a classic case of a helpful root doing the wrong thing to the wrong body. 3. Guarana. This one hides in those flashy energy drinks. But guarana is loaded with caffeine, more than coffee. It's a natural stimulant that can make your heart race and your arteries tighten. If your doctor ever told you to cut back on caffeine, don't just look at your coffee cup. Read those energy drink labels too. 4. Bitter orange. Now here's the tricky part. Bitter orange is often in weight loss pills. People see natural fat burner and they get hopeful. But it contains synephrine, which mimics adrenaline. It raises your heart rate, constricts your blood vessels, a cocktail for stroke warning signs if you're not careful. 5. Yohimbe, marketed for male vitality, but let me tell you, nothing kills romance like a trip to the emergency room. Yohimbe can dramatically raise both blood pressure and heart rate. If you're over 60, please talk to your doctor before touching this stuff. And here's what shocked me the most, even common pantry items like canned soups, frozen meals, and store-bought sauces are laced with hidden sodium. In the next segment, I'll reveal which everyday foods are quietly pushing your numbers up and how to swap them out without losing flavor. Was any of this new to you? If so, let me know in the comments. And hit that like button, not for me, but for someone else who might stumble across this video and think twice before brewing that next healthy cup of tea. Let me tell you something that might surprise you, friend. The most dangerous foods for your heart and blood pressure aren't always the ones that taste salty. Some of the biggest culprits come disguised as everyday, innocent pantry items. Back when I was 68, I used to eat canned soup for lunch. Every single day. Chicken noodle, tomato basil, you name it. Tasted great, took no time to prepare. But I couldn't understand why my blood pressure kept rising, even though I was cutting back on salt at the dinner table. What I didn't know back then is that these convenient foods were quietly raising my sodium intake through the roof. And I'm not alone. Millions of seniors are unknowingly putting themselves at risk of stroke, heart attack, and even kidney failure, just by what's sitting in their kitchen cabinets. The hidden killers. 1. Canned soups and vegetables. Did you know a single bowl of canned soup can have more than half your daily sodium limit? It adds up fast, especially when we're used to seasoning everything. Even the healthy or low-fat varieties often hide sodium to preserve flavor. 2. Processed meats. Bacon, ham, sausage, even turkey slices from the deli, they're all packed with sodium and nitrates. Sure, they make a sandwich easy, but they're tough on your arteries. A lifetime of eating deli meats without knowing the risk nearly cost me mine. 3. Frozen meals. Have you ever grabbed one of those microwave dinners because you're tired or just don't feel like cooking? I have. They're convenient, but many contain 900 milligrams to 1,200 milligrams of sodium, almost a full day's worth, and that's just in one tray. 4. Snack foods. Chips, crackers, even some popcorn labeled light, don't be fooled. Just one serving can contain more sodium than you'd expect. And let's be honest, whoever stops at just one serving. 5. Sauces and dressings. Soy sauce, salad dressings, even ketchup, a tablespoon here, a squirt there, it adds up. I once measured how much salad dressing I used in a week. Let's just say, I could have seasoned a small lake. But here's the kicker, even those morning bowls of cereal and healthy, whole wheat bread can pack more sodium than a bag of chips. In the next segment, I'll uncover which health foods are hurting your heart, and what to eat instead. If you found yourself nodding along, maybe recognizing a few of these foods from your pantry, give this video a like. And let me know in the comments, what's the one food you thought was healthy but turned out to be hurting you? Let's learn from each other, we're stronger together. You know, I always thought that choosing foods labeled as heart-healthy or low-fat was the right path. But what if I told you that some of these superfoods might be silently sabotaging your health? 1. Flavored yogurts. Often marketed as healthy snacks, flavored yogurts can contain high amounts of added sugars and sodium. Opt for plain yogurt and add fresh fruits for natural sweetness. 2. Whole wheat breads. While whole wheat breads are a better choice than white breads, some brands add extra sodium for taste and preservation. Always check the nutrition label for sodium content. 3. Canned vegetables. Canned vegetables are convenient, but they often come with added salt. Rinse them thoroughly or choose no salt added versions. 4. Energy bars. Marketed for fitness enthusiasts, some energy bars are loaded with sodium and sugars. Look for bars with minimal ingredients and low sodium content. 5. Plant-based meat alternatives. These are gaining popularity, but some are high in sodium to mimic the taste of meat. Moderation is key, and always read the labels. But here's the kicker, even some low-sodium labeled products can still contribute significantly to your daily intake. In our next segment, we'll uncover these surprising culprits. If this information resonates with you, please like the video and share your experiences in the comments. Your story might help someone else. When I turned 70, my blood pressure was still high, even after switching to all these low-sodium products. I was frustrated, confused, even angry. Wasn't I doing everything right? Until one day, my granddaughter showed me the label on a low-sodium cracker box. It had 180 milligrams per serving, and I was eating 5 servings without realizing it. Let's dig deeper into this sodium deception. 1. Reduced sodium soups. These may have 25% less sodium than regular versions, but that still means 700 to 800 milligrams per serving. And nobody eats just 1 serving. 2. Low-sodium soy sauce. Still has around 500 to 600 milligrams per tablespoon. I used to drown my veggies in it, thinking it was healthy. 3. No salt added canned foods. While it sounds perfect, the natural sodium in vegetables still adds up. And the sodium in preservatives often sneaks in. 4. Packaged meats and deli slices, labeled lean or heart smart. Don't be fooled. Even low-sodium turkey can have 300 milligrams per slice. Make a sandwich with 2 slices and you've got a sodium bomb. 5. Light dressings or marinades. Low fat? Yes. Low sodium? Not always. Many add sodium to compensate for lost flavor. I used to drown my salads in this stuff, thinking I was being healthy. 6. Protein powders or meal replacements. Yes, even those. Many fitness shakes have added sodium for taste and shelf life. I remember clearly, one night I had a so-called low-sodium frozen dinner, followed by a protein shake before bed. The next morning, my feet were swollen, and my blood pressure was 172/98. That was my wake-up call. Coming up next, 3 foods doctors rarely warn about, but they can cause sudden spikes in your blood pressure, especially in seniors. And hey, if this video is opening your eyes like it did mine, smash that like button. And share in the comments, what healthy food surprised you with its sodium content. Let me ask you something, have you ever started your day with a so-called heart-healthy breakfast and ended up feeling anxious, your heart pounding for no reason? It happened to me. And it was terrifying. Instant oatmeal packets, we're told they're good for our hearts. But many of these packets, especially the flavored ones, contain over 250 milligrams of sodium and heaps of sugar. The sugar spikes insulin, and over time, that quiet climb in blood pressure becomes a storm. I remember switching to steel-cut oats with a bit of cinnamon and berries. That one change. It calmed my mornings and my heart. Cottage cheese or low-fat cheese, it says, high protein, low fat. But 1 cup can contain up to 800 milligrams of sodium. That's more than 1/3 of what a senior should consume daily. Read the labels. Your next choice might save you from a silent stroke. Tomato-based pasta sauces, they seem innocent. But even the organic or heart-friendly ones can have up to 600 milligrams of sodium per half cup. And who uses just half a cup? The night I ate spaghetti with that sauce, my pressure hit 186/96. My doctor almost sent me to the ER. That week, I had all 3. Flavored oatmeal for breakfast, cottage cheese at lunch, pasta sauce at dinner. Boom, hypertension crisis. In our next story, I'll reveal the healthy drink that may be undermining your blood pressure every single morning. If this helped you, like, comment your sodium surprise moment, and subscribe for more wisdom from this old rocking chair.